I am Lusine Poghosyan. I am a faculty member at Columbia University School of Nursing and Columbia University School of Public Health. And I'm also a director for Center for Healthcare Delivery Research and Innovation at Columbia, New York. And it is my pleasure to be here today to have a chance to talk to you a little bit about the nurse work environment, burnout, job satisfaction, turnover, some of the nurse workforce outcomes, and how that impacts patient safety and patient care. So, what I'm going to do in the next 40-45 minutes, that's typically, I think I can keep people's attentions for 40-45 minutes. But if you have any questions while I'm talking, please feel free to interrupt me, ask your questions. I'll be more than happy to answer any questions that you have. So, in the next 40-45 minutes, I am going to talk about how nursing workforce transformed in the US from being a smaller hospital-based program to into a reputable profession. And also, I'll talk about some of the global nursing workforce development. I don't have to convince you that nurses matter, but I want for us to take a few minutes to think about it, because very often I give talks in non-nursing audiences, and I need to find simpler ways of saying why nurses matter. And I think it's important for all nurses to have that simple points of saying, this is why nurses matter, because we know how in a healthcare system, sometimes nurses, are not given the opportunities or the resources they need or they deserve. So I want us to have a time to talk about why nurses matter, why anybody should care about nursing. Then I'll talk about what is a nursing work environment, what are the nursing outcomes, and why is this important for patients? Because I think one of the most important things for us is to think that nursing workforce is key for patient safety, for quality of patient care. So I wanna share some evidence with you to really see what's happening in the world when it comes to nursing workforce research. And I will leave you with a couple of suggestions and things that could be important for us to think about how to strengthen nursing workforce and what are some of the key points. So that's the plan for the next 40-45 minutes with you all. So I want to kind of show this to you how nursing workforce developed in the United States. Some of them became a reputable profession with master's and doctoral degrees, and now is considered the largest healthcare one of the largest healthcare workforce in the country. So initially, when the nursing became a profession in the U.S., it started from 1800s, and it was in the hospital, nurses there delivering informal care. But later on, as the healthcare system developed, hospital realized that they need more qualified nurses to be able to deliver complicated and complex patient care. So then nursing developed into a reputable profession, the bachelor's degrees, master's degrees, and PhD. And in 1970s, many new programs were introduced in the US, like it's called advanced practice nurses. These are nurse practitioners, clinical nurse specialists, nurse midwives, and CRNAs. These are certified nurse anesthetists. These are master's prepared or doctorally prepared nurses that can deliver anesthesia care during surgery. So in this timeline, I want to show you just the evolution of the nursing workforce, that we had many educational reforms, technology was being advanced, because, and it's going to continue to advance, as many of us know. Let's see if I have a question on the chat. Is that okay if I check? It looks like no, it's only the evaluation form. So I want to make sure I don't miss anybody's questions. Okay. And now nursing is really being a reputable profession, both in the US and also globally. So I don't want to say that it's only, I just wanted to kind of start with the US, but now more than ever, many people across the world are trying to become nurses. And globally, there are about 30 million, 28 million professionals that have some kind of nursing education in the world. And it is fundamentally believed that nursing is the backbone of the healthcare system. if we really want to deliver good quality of care, we want to improve patient outcomes, then we have to have a strong nursing workforce capable of delivering this care. But there are a lot of issues that, and I'm going to talk more about in various kinds, but I wanted to put this here. Just because we have 28 million nurses, especially in high income countries, average age of a nurse is about 47 years old, which means many nurses might be retiring and leaving the workforce. And globally, some estimates show that about 6 million nurses are planning to exit the healthcare system, and the global shortage might reach up to 6 million globally. It means this many patients are going to suffer because of lack of nursing and nursing shortage. As I said earlier, is that this is the first time probably in history that many nursing workers continues to grow. Despite these shortages, despite the challenges, nursing workforce in most countries continues to grow, but not fast enough to really meet the demand by aging population, by chronic disease burden, and post-pandemic recovery pressures, because we know that pretty much in most countries, people are getting older. With age, it comes the chronic disease burden. People are having multiple chronic diseases. They're living longer. And this requires a high quality nursing care. We also remember pandemic. It wasn't that long ago that really affected the nursing workforce, particularly the turnover and burnout and aging nursing population. So what we are seeing is that despite more young people going into a nursing profession, nursing workforce is being expanded in most countries. It's not still enough to help meet the increasing demand for healthcare services because of burnout, attrition, and in many high-income countries, the gap by the retiring nurses, which creates a huge gap between supply and demand. I wanted to put something to show you the comparison. This is and I want to make sure that Thailand was here. This is the chart that shows the shortage projected in Asian countries. I just wanted to put, and you can see that all of these countries are going to experience shortage of nurses, and of course, China and India are going to have a much higher shortage, and Thailand is somewhere comparable to Vietnam and Japan. So, but it's still going to experience nursing shortage in the near future. Why do nurses matter? So if someone asks us if we're going to talk to healthcare leaders, if we're going to talk to policymakers, how can we convince that nursing matters in order to ask for investment in nursing, to ask healthcare leaders to really give resources to nurses? So nurses are the backbone of the healthcare system. I put here in the US just to make it, US, because that's the system I know the most. But this is very true for all healthcare system. Nurses are the backbone of the healthcare system. They are the patient, they are directly involved in patient care. They are the primary point of contact for patients, providing high quality care, advocating their needs, and ensuring personalized holistic care throughout patients' journey. So this is one of the most vital roles of nurses, that when someone goes to hospital, they have the longest relationships with nurses. And the healthcare system cannot operate without nursing care. Clinical expertise and safety. We do have nurses for delivering clinical care. They are the ones who administer the medications. They are the ones who are watching patients. And as soon as if patient situation gets worse, nurses are the first ones that can really prevent complications and ensure safety. When you do not have enough nurses, it is possible that signs and symptoms of complications that occur among patients can be missed because you don't have enough nurses or you have overburdened nurses. Nurses are also critically important for the system, overall healthcare system efficiency, because we know that nurses are the ones who coordinate the complex care plans, because patients need various types of care to be able to, to achieve outcome, to recover and become healthy. Nurses are the ones who manage the transition between care settings, from hospital to home, from primary care to hospitals. and nurses can really help save the resources. They can help optimize the use of resources. One of the interesting things that happens in the US, there is this survey called Gallup poll. So every year, this poll asks regular Americans, which is the profession that you trust the most? Regular people on the streets, in their home. And guess what? For 23 years, nurses were the number one profession. So if most Americans who are surveyed, they trust nurses, which is more than firefighters, more than teachers, more than any other profession. Nurses are the most trusted profession in the United States. So I'm really hoping, when I have a chance to give this type of lectures internationally, I really hope to see this type of numbers in other countries as well, because it shows how much the community trusts nurses, how much patients trust nurses, how much general public trust nurses. By 23 years, every year, nurses are the number one most trusted profession. But despite that, both in the US and globally, nursing is facing a shortage. Let me summarize all the points why are nurses short. One of the biggest thing I already spoke about is the aging population. It doesn't matter how fast nursing workforce grows, population is aging faster. So that's one of the biggest reasons for nursing shortage, that aging population increase the healthcare demand, but we're unable to meet it. The other biggest reason is the working conditions. Nursing is a challenging profession. It's a high demand, both personally and professionally, and working conditions are not supportive of nurses to be able to do their job. And I'm going to talk a little bit more later what are these working conditions, but evidence is clear that poor working conditions are one of the main reasons for nursing shortage, for people leaving their jobs, nurses leaving the profession, and it's really contributing to nursing shortage. The other thing is retention crisis. We are not able to particularly retain new nurses. In many countries, including US, new nurses leave their job very fast because we do not create good mentorship opportunities. We do not create good work conditions for new nurse who graduates from a nursing school, goes to the hospital or any setting to stay in the job. It's a huge crisis because newly trained nurses are leaving within 6 months. More than like a half leaves their job. And that's not really, that creates a large issue for hospitals, for healthcare systems. So, and if you don't keep new nurses, then, they don't have the experience opportunity to develop their experience and become experienced nurses. The other thing in the US, and I'm sure it probably is in Thailand, education capacity is smaller. What does it mean? It means that we don't have enough nursing school space or faculty to train new nurses. For example, I'll give you one number. In the US, every year, 80,000 students are not accepted. They're qualified. They have good scores. They're not accepted to nursing schools because nursing schools do not have professors to teach them, faculty to teach them. So that's one of the other issues, that because if you have an aging nursing workforce, it means you also have aging nursing faculty, and the nursing schools cannot accept new students to really train them to become nurses. And of course, we all know high burnout. Nursing is the workplace stress, understaffing, poor working conditions drive nurses from the profession prematurely. Many nurses retire early. Many nurses leave the profession because of the high burnout rates. And we all know COVID made it even worse. The burnout has been a chronic issue affecting nurses many, many years. It just COVID made it more visible, and that's a big issue. And one of the things that is pretty universal, I would say, across the globe, is the compensation issues. Nurses' salaries are not good. Even though, let's say, even for United States, even if their salaries are much higher than in other parts of the world, it's still they don't get promotions. They don't have compared to other professions, their salaries are not high. And one of the biggest thing is also in the US and in many other countries that nurses sometimes make more money in urban areas than in rural areas. and it's really hard to attract nurses in geographic areas where there's a huge need. So these are some of the summary factors that I think contribute to nursing shortage and are root causes of a nursing shortage. This is an issue not only for nursing profession, but this is issue for patients. And I think that's what we need to think about. How is nursing shortage affecting patient safety? We know, and research is clear, that if hospitals have adequate number of nurses, then patients in these hospitals are less likely to die. So patients who get care in hospitals that do not have enough nurses, patients die. And I think that's one of the clear points that evidence that shows that indeed nurse staffing is associated with patient mortality in the hospitals. And we also know that if we have lower nursing workload, it reduces medical errors. We know that when nurses take care of fewer patients, they have more time to monitor, catch, and prevent errors and complications. And if nurse works in a hospital where there are not enough nurses, it means they have to take care of more patients, they have to do more work, and then this really reduces their attention, being able to catch the errors, and leads to medical errors. We also know studies show that if you have better staffing, enough nurses, it improves infection control. Nurses, patients in these hospitals have lower infections if the hospital has enough nurses. And we know how it's a big issue to hospital-acquired infections are a challenge in the healthcare system, and staffing is critically important. And lastly, I think increased nurse presence leaves faster response times. If something goes wrong, if you have enough nurses, they're going to catch it and they're going to prevent it before things get even more complicated. And again, there are studies who show that you do need to have nurses to be able to catch things when they go wrong. And we know how complicated healthcare systems are. And finally, nurse well-being enhances vigilance. Overworked nurses are who are tired, who are overworked. They're more likely to make mistakes, and this is why it's important to really have adequate nurse staffing to help nurses to be able to do their job and promote patient safety. So I think all of these points that I've made here, there are studies that support this. I'm going to show you a couple of examples later, but this is the summary of why nurses are important for patient safety. And of course, compliance with the safety protocols. If nurses are, I think I mentioned that you need to, if you have enough nurses, then they're more likely to comply with the protocol. I'm going to show you a study from, this is my colleagues from University of Pennsylvania who have done studies in many countries, and they've shown that nurse staffing and well-educated nursing workforce is associated with hospital mortality in 9 countries. So what they did, they got all the mortality patient data from these hospitals, and they saw that hospitals where they had enough nurses, patients were less likely to die. For example, each 1 patient increase in patient per nurse was associated 7% increase in hospital mortality. So they found same result. If you give a nurse 1 more extra patient to take care of, with every increase, the patients are 7% more likely to die. So, and they found exactly the same relationship across all countries that they have studied. Okay? So there's enough study that says, enough evidence that convinces us that you do need to have adequate nurses. Okay, so we have adequate nurses. Is that enough? Is having just a number of nurses enough for patients to get a good care? Research shows that no, that is not enough. We also need to create good environment for these nurses to work, because having adequate number does not necessarily mean that it translates into a better patient care. There's a robust body of evidence looking at a nurse work environment. What is a nurse work environment? Work environment is an organizational characteristic of a setting that helps nurses to helps or prevents nurses from doing their job. either facilitates or constrains professional nursing practice. So there are many ways people measure nurse work environment, but one of the most common ones is this instrument, PSNWI. It's a nurse practice work environment index that looks at the 5 domains of the work environment. What are some of the things that are important for nurses in the clinics or in the hospitals to deliver care? It's, do they have enough nurses, staffing and resource adequacy? Is the nurse manager able to lead nurses and support nurses? What's the relationship between nurses and physicians? And are nurses participating in higher level decision making in the hospitals? And are they able to deliver care according to their nursing education, their training? What are the foundations of a quality of care? So, and this tool has been developed like 25 years ago, and since then it has been used in many countries. I'm going to show you one example from a study that was done with my colleagues from University of Pennsylvania. I hope you're able to see this. So the study was done in US, China, South Korea, Thailand, Japan, New Zealand, UK, Canada, and Germany. What the researchers did was surveyed nurses on their work environments with the tool that I just showed you. And then they ranked and they aggregated to a hospital level, and they looked at the scores. So the range and the median. As you can see here, there's wide variations, right? Like usually like presenting the median because it's a 50% or more reporting. What is Thailand? Thailand is, for example, on nurse-physician relations, the average score for Thailand is 3.1, while for US is 2.9, China 3.5, South Korea 2.5. So you see Thailand is kind of in the middle among all these countries about the work environment. But you can see how different work environment domains are across the countries. And in the below of the table, you see that researchers use these scores to rank poor environment, good environment, and a better environment. The poor environment were the scores above the, you can see the calculation below. And the better environments, let's see, what is Thailand? About 35% of nurses working in a better environment. So the point here is that work environments vary across the countries. In the next slide, I'm going to show you. So in the same study, researchers also asked nurses about their level of burnout, job dissatisfaction, and also if they're able, they feel confident that the patients can take care of themselves after they discharge, and also ask nurses to evaluate their quality of care in their hospitals. So you see that about 42% of nurses in Thailand reported to be dissatisfied, high burnout, and 27% was dissatisfied with their job. But can you see Japan? Japan has always been interesting. I did studies in Japan in my dissertation year since 2008. Japan is always interesting. And the average nurse in Japan when I was doing study was 27. So apparently nurses leave their job within 3 years. So again, in this data as well, Japan seems very kind of an outlier. That a lot of nurses do not like their job. And then what else? And the quality of care, similarly, nurses who do not like their job, they also report that the quality of care is not good. So you see there's a wide variation of poor outcomes among nurses in these countries. In the same paper, this is what they did. I would like us to look a little bit more on this table. So what they did, the researchers, they looked at the level of burnout, job dissatisfaction, no confidence that patient can manage, is well prepared after the discharge, and quality of the care in their units by work environment scores. These are the poor, mixed, better. As you can see across all countries, burnout is lower among nurses who work in a better work environment. I'll pick Thailand, for example. If nurses work in a poor work environment, 43.1% is burned out. But if nurses work in a good environment, 27.2% are burned out. So you see the differences. Let's pick another country. We can pick US. Similarly, about 39.6% of nurses working in the poor environments are burnout compared to 27.5%. And all these outcomes, similarly the job dissatisfaction, similarly the confidence in patients being prepared for discharge, quality of care, consistently you see that if nurses work in a bad environment, these outcomes are worse. And you can see how culturally, economically, healthcare system wise, all these countries are very different, right? Like how they manage their healthcare system. But the consistent argument is that still, a nurse work environment in these hospitals matter. Okay. Okay, so and then I wanted to put something more recent from the US. The US has this US has this national survey of nurses, and I wanted to see if things have changed post pandemic. And interestingly enough, here you can see that right now there are about 3.5 million nurses in the US. And based on this, you can see how high the burnout rate is and how high the job dissatisfaction is. For example, moderately dissatisfied with their job and extremely dissatisfied is 5%. Moderately is about 15%. That's the dark blue on the circle. I'm sorry you can see it from here. I can see on my screen. And similarly, on the right table, you can see the burnout that, once almost 10% of the nurses, 20% of the nurses say a few times a week, and 25% of nurses say every day they feel burned out. That's really terrible. If you go to job every day and you feel burned out, that's not good. And that's the situation of nurses in the U.S. Similarly, about the turnover. In this study, they also asked nurses how many plan to retire. Look, almost 40% say I'm either going to leave my job or I'm going to retire. What does this mean? This means that healthcare system have to try to replace them, right? Because you can't really operate a hospital or a clinic without having adequate number of nurses. And we know that hiring and replacing one nurse in the US can cost up to like $61,000. And imagine losing all of these nurses every year at the cost that it's going to cause hospitals. So that's why it's really important for hospitals to make efforts to keep nurses, because you don't want to hire them and then lose them. That's costly. And here I would like you to summarize the effects, and then I'm going to show you some studies that I was part of many years ago, and then we'll have more concluding points. So here, I hope I don't have to convince you that work environments are important. If you have a bad environment, it's going to affect nurse burnout, and then it's going to lead to a poor quality of care and outcomes. And we really need to do a better job of investing in nursing work environment. This was a study from my own work I did, many years ago. Again, in this study, I had data from nurses in US, Canada, UK, and I use this data to understand if nurses are burned out, does that affect quality of care in the hospitals? Because so far, right, we're showing that a work environment affects nurses, affects quality of care. But I wanted to say, okay, if you have a hospital where nurses are burned out, does that affect quality of care? And this is my regression results where the burnout was measured with this instrument called Maslach Burnout Inventory. It has like 22 items. And the items are grouped into 3 subscales: emotional exhaustion, the personalization, personal accomplishment. And across all countries, I showed that nurses burnout affects quality of care in this hospital. So indeed, we need to have good environment. We need to prevent nurse burnout, so we can have a better quality of care in these hospitals and make sure that patients have the best outcomes. Okay, so that's the conclusion of. So far I've shown you that we do need to have enough nurses. That's the staffing, right? That I spoke to you about, that hospital need to have enough nurses. When you have enough nurses, you need to have a good environment for these nurses to work. When you have a good environment for nurses to work, it reduces bad outcomes, it reduces burnout, it reduces job satisfaction, dissatisfaction, it reduces turnover. And then when you have burned out nurses, it affects quality of care. There is well established body of evidence that says these are some of the outcomes that are sensitive to nursing care. So if you don't have enough nurses, patient falls are higher, more patients are going to fall into hospitals, pressure ulcers are higher, infections are higher, and hospital readmissions are higher. So that's why it's all these things are indicators of a better outcomes for patients, and it's really important to invest in nursing workforce. There's a systematic review that was published a few years ago. It's a new one. I don't have the year yet. 2022, I think. Yes, 2022 it was published. So in this review, the researcher did a systematic review on nurse burnout and patient safety, and what they found that nurse burnout is associated with safety climate. If it's burned out, it means the patient safety suffers. If nurses are burned out, there are more infections. You can see the direction of the arrow. If nurses are burned out and have bad outcomes, patients fall, medication errors are higher, adverse events and other patient safety incidents are higher, missed care is higher, and nurses assess quality of care is lower. So indeed, there is robust evidence across all the studies that show that nurses, it is really important to invest in nurses and help nurses to deliver better care to patients and enhance patient safety. I'm going to show you one table that is from one of the papers with my postdoctoral fellow. I think we published again 2022 or 2023, where we said, if we improve work environment, we can reduce patient burnout, and then we can reduce bad outcomes. So far, remember, I was showing you studies that were looking at the direction of only work environment, nursing outcomes, nurse outcome, patient outcome. In this paper, we tried to put everything together. We said, can nurse work environment moderate effect, burnout moderate the effect of work environment with patient outcomes? So, and what we found is that higher odds of patient mortality, failure to rescue, I'm going to explain to you what it is, and prolonged length of stay were found in hospital that had average higher nurse burnout rate. But the important point is the middle one, that good work environments can really reduce the relationship between burnout and mortality and failure to rescue and length of stay. Failure to rescue is a measure that says how fast nurses can recognize when a complication occurs in the hospital before patient dies. Because sometimes when a patient stays in the hospital, complications can occur. If you have enough nurses, then nurses can quickly recognize that, oh, the patient's condition is going bad, let's take action. So that measure has been developed by Jeffrey Silber at the University of Pennsylvania that says, you don't wait until the patient dies to use that as a measure. It's important to really prevent complications. But we also found that good work environment really changes the relationship between burnout and mortality. For example, how can we easily interpret that is that nurse burnout affects mortality, but if nurses work in a better work environment, it reduces the mortality. So basically in your regression model, if those of your PhD students, patient outcome is the Y, work environment and the burnout are the predictors, and then there's an interaction term between work environment and the burnout. So that's the kind of modeling we did. The others is the magnet status. I don't know if there are magnet status hospitals in Thailand, but this is some kind of recognition for hospitals that say these hospitals are good places for nurses to work. And that was also positively associated with the better outcomes. So what can we do? I'm going to have some water first, and then I'll tell you. Is that okay? In Thailand, yeah, it's in the US, a lot of hospitals have magnet recognition, and sometimes they're trying in Europe as well, which based to help you all understand what it is. It means it's a good place for nurses to work. It's a simple way of saying it. So there's an organization that comes and assesses and then says, okay, you meet this criteria for magnet that it's a good place for nurses to work. Yeah, please go ahead.
I want to ask you a question.
Please.
Because the quality of care have many indicators, so you focus on the safety or other outcome in your study?
You're absolutely right. You ask a very good question. It's like, how was quality of care measured?
Yeah.
So on the most of these studies that I've shown you, quality of care was measured by the perceptions of the providers.
Perception.
But then there's a study that says perception of provider and the real quality care objective measures match. So there's a body of evidence that says perceptions of the providers is accurately can capture real quality of care delivered. So in most of these studies, we were asking either, please rate the quality of care in your hospital or in your unit during the last shift. So last shift, and then our colleagues have done studies that show that that question is really predictor of a quality of care indicators in the patient's claim Medicare claim data.
So you evaluate the nurse's perception or the patient's perception?
This is a nurse's perception.
Oh, nurse's perception.
This is nurse's perception. No, you're right. That's a good question because quality of care is difficult to measure. Like what?
Yeah.
There's so many indicators for it. But in some studies that I spoke, I don't know, you're not here yesterday. We use patient outcome measures that emergency department use and hospitalization, saying that because we do studies in primary care, we don't want patients to go to emergency room. For us, that's a patient outcome measure. But then for quality of care measures, we sometimes go into patient charts and take like H1B, like the blood pressure control. Are your patient's blood pressure controlled well? Are their A1C level appropriate? So these are some of the indicators we also use, but not here. Sounds good? Okay. I just have a few more points. If any other questions, I'll be happy to answer, or I can continue just to summarize. Okay, let me summarize that. Because I think overall goal, what I wanted to share with you today was, and of course you know this, but I wanted to show you some of the studies. I wanted to show you some of the empirical evidence that when we talk about nursing workforce, there are studies to support our arguments. We're not just saying, oh, nurses are good and we have to help nurses, but there's an evidence that shows that nurses are important for the well-being of the healthcare system and patient safety and patient outcomes. So what can be done? There are a lot of recommendations in the literature what to do to help nurses, to help the healthcare system to have adequate nurses. So some of the recommendations are expanding nursing education, workforce development, and creating an infrastructure for nurses to be able to practice, fully practice. I remember I mentioned to you that in many countries, and including in the United States, students want to become nurses, but they're not able to do it because schools are not able to hire them or accept them, or faculty members are I cannot accommodate them. Also, their tuition is very high in many countries for nursing. I don't know, some of you heard, thank you so much. Some of you heard that, especially to get master's or doctoral education, U.S. government stopped giving loans to nurses. That's going to affect nursing education, but it's really important to continue funding nursing education so young people who want to go into nursing are able to borrow money to become nurses. So I think there are a lot of changes that at policy levels can be. At a university level, it's really important to hire new nursing faculty and expand the capacity of the educational program. I think one of the things we're doing at Columbia now is that we have a very strong simulation lab. We're trying to kind of increase the program's capacity and teaching some of the technical skills in the simulation labs, because it's always hard to get the clinical replacements, clinical placements. So those are other things. And then one of the most important things is creating a supportive environment. You can't really strengthen or grow the nursing workforce if people don't want to work in that environment. It's a challenge if they're putting their health at risk, they're putting, their families at risk. We know that during COVID, nurses were coming to hospitals and taking the infections back home. And they're not enough precautionary equipment to protect nurses. So these type of environments are risking the long-term development of the growth of a nursing workforce. And also in many countries, unfortunately, nursing is not seeming to be a rewarding profession. Many young people, I've done some international research and I'm learning that nursing is not very reputable profession. Young people don't want to become nurses. But I think it's really important to really advocate for it, increase public's awareness that nursing is a valuable profession and it's critically important and it's very respectable. So I think there's a lot of work needs to be done to really increase the awareness about nursing profession. So in conclusion, the demand nursing care and nurses will grow. Um, it doesn't matter what happens with the economy and the world. We know that nurses always are going to be needed and their care is going to be they're needed by the patient. So they're going to continue to grow. We really have to figure out how to attract, train, and then keep nurses into healthcare system. Attract, we need to increase awareness, let people know that nursing is a reputable profession, train them, increase the capacity of the education system that can accommodate, and then we need to retain them. When they're good nurses, we should not create bad environment that they really live. And nursing shortage is a solvable problem. It's not impossible to address nursing shortage, but we just have to have a organized efforts from education, from the healthcare system perspectives, from the incentives and government to come together to really address these issues. And really, it's important for maintaining nurses' well-being. When we really invest in nurses, we're going to invest in everyone's health. Societies that have a strong nursing workforce are more likely to have a strong population health. So that's what I had for you, as I said, about 45 minutes. So I hope you all know, and I don't have to convince you, but our summary points are that nurses are essential for healthcare delivery. We do need to have nurses. And we know that, unfortunately, the nursing shortage and burnout are threatening the workforce stability. If we keep seeing these high levels of turnover, high level of burnout, the workforce is not going to be sustainable. We also know that a work environment affects patients directly and indirectly. Directly, patients getting bad care in a bad environments have bad outcomes, or indirectly through bad nurse outcomes. We saw that nurse burnout affects patient care, and we really need investments in recruitment and retention of nurses is critically important. I hope this is what you're hoping to get today. Thank you so much, and I'll be happy to answer any questions you may have. Thank you for being here. Thank you. Okay. I see one chat. Let's see. Okay. Okay, thank you. So there's a question. Let me make it Gorawit. Am I pronouncing it correctly? I hope I am. My apologies if I'm mispronouncing. The question says, thank you for your insightful presentation. Well, thank you. On my view, in Thailand, many nurses are concentrated in large cities, while rural and tiny cities continue to face shortage of manpower. From your perspective, do you think workforce's distribution could also be part of the nursing shortage issues? Absolutely. Thank you for the question. You're absolutely right. And the same thing is in the United States. For example, I live in New York City. It's a big city. We don't have a nursing shortage. You drive outside of New York for 2 to 3 hours, hospitals cannot hire nurses. You're absolutely right. And I didn't mention that point that not only we don't have enough nurses, we also don't have enough nurses in the right places. And geographic maldistribution is really a key contributing factor for nursing shortage, both in the US and many countries. I've done some studies in Japan where there are many rural clinics that have struggled hiring nurses. I've done studies in Europe, in Greece, similar issue. Greece has a lot of islands where there are no nurses. And in the US, it's a big country. Cities are usually paying more and have more nurses, but in rural areas, in small clinics, in public clinics, it's really hard to get nurses. So thank you for your question. You're absolutely right.
I want to ask
Please.
you a question.
Please.
Because because I have a friend in your school, Columbia.
Oh,
She told me she is a nurse many years ago. She said she has do some basic care in the world because sometimes they are very busy and no workers help them do the basic care, so they must do it for themselves. So if I don't know US about the nurses and the workers, their responsibility for the worker. Sometimes, if the nurse do some basic care for the patients, they have no time to do other very important thing for them. So I want to know how the nurse deal with this situation because it is very important for most nurses.
no, you're absolutely right. One, there was a study a few years ago. I saw it was called spending time on non-nursing tasks.
Oh yeah.
So there's a research about that shows how much time nurses spend on doing non-nursing tasks. So, and I remember I had a colleague whose study was she would go and sit in the hospitals and would write down. It was an observational study to see what nurses do and how much time they actually spend doing non-nursing tasks. Honestly, I mean, I honestly don't have a solution for that one, but it's again creating a better environment for nurses because that's also not beneficial for the hospital, right? You pay nurses a higher salary than low in other employees, but nurses are doing lower level tasks. So yeah, it's unfortunately it's very common, and I think it comes down to a poor work environment, poor leadership, lack of shortage of also other workers. And I don't know what workers you're talking about, but they're also in the US. They're called licensed practical nurse.
Oh yeah.
Or they're called nurses, but they're not really nurses. They're much lower level skill employees. But sometimes they can also hire them either, so somebody has to do the work. But you're right, nurses it's overburdened. Nursing care is high, burden is really high.
Yes, yes.
Yeah. And what is your friend studying at Columbia?
Jiao right.
Oh, so not in a nursing school?
Yeah. I think your card to her, she said you are her teacher.
What's her name?
Her name is writer Jiao. But
Okay.
Jiao,
Georgia.
yeah. My name is Chunxiang Li.
Okay.
Yeah.
Okay. And because I have a lot of students, sometimes you ask your friend to send me an email. Ask your friend, I requested her send me an email.
Okay.
So she can come and meet me when I'm in New York.
Okay.
Please ask her, okay? So, okay. Thank you. I'm so glad. I always like, I'm so glad to hear that.
Yeah.
Okay, ask her to email me.
Okay.
Okay. And did she go to Chiang Mai University also or no?
No. We say each other in Singapore.
Oh, okay.
Yeah.
Okay. Ask her to send me an email.
Okay.
Mm.
Okay.
I do agree with you that nurses in Thailand,
Yeah.
we also met the issue that we spend time with non-nursing care. So
Yeah.
that's why, we have to record, we have to put some information, even though on the paper and, in the computer to measure or many indicator that we have to put
Yeah.
and record.
Yeah. I think in that study I was telling you that my colleague would write down. So I remember some of the results like, take the pillow from one floor to another floor, or answer a phone that has nothing to do with the patient care. And I was writing how much time it takes you to take one pillow from one floor to another floor, but I think it also comes down to the system, right? If you have a good system, everybody works together well, they know what they're supposed to do, this type of issues don't happen. But unfortunately, healthcare systems are very complicated, I see there's another comment. It seems like a cycle. The shortage of nurse educators limits the number of new nurses, which contributes to workforce shortages. This is the increased workload and may affect the quality of care. You're absolutely right. You're absolutely right. It's one of those, where do you intervene to see a change? Should you hire more professors to teach them? And then nursing schools say, oh, it's too expensive, we cannot do it. So you're absolutely right. We're in this cycle of like constant nursing shortage. But in the US, in like in 80s, 90s, the situation was worse. And because people didn't want to become nurses. And then there are big public campaigns to increase awareness of public how important nursing is. And that really changed the number of nurses coming into nursing programs and making nursing a reputable profession. Now, many students and many young people want to be nurses in the US because it's very prestigious, it's reputable, it's a good salary, you can always get a good job and have a good life. But that was not the case in the 80s, in 1980s. So I'm hoping that type of things will change also in other countries that really show how the value of nurses to the society.
You travel a lot and work with the faculties in different countries. From your experiences, what are the strategy that you think is work to attract new nurse in the system?
No, you're right. I think I do, and one of the things I love traveling and working with other people because I learn a lot from other experiences. Increasing public awareness. Because if family members do not want to send their child, high school graduate to a nursing school, right? Like, what is the average age when people go to university? 18 years old? 18, right? And families have an impact. Families have a decision, right? So what I have seen is that when public accepts nursing as a reputable profession, it makes a difference. Then families encourage their children go into nursing school, and the conversation about nursing is reputable. So I think that's one of the things I've seen. You need to improve public's awareness because families, if they don't think nursing is a good profession for their kid, they're not going to send them. So I think that's one of the things that I think can impact. And then, of course, healthcare leadership. You have to pay nurses. You cannot improve the status of nursing when people don't think nursing is a good job that can help them to make living. Nobody wants to work that hard in bad conditions and not be able to afford a life for themselves and their families. I think those two factors, when leaders realize that, okay, this is important, we need to invest, and then increase public's awareness that this is a reputable profession and a good career path for the young generation. I think those two things can work together and have a big impact. Well, how is it in Thailand? Do families want to send their children to nursing school or no? Yeah? Okay.
After they graduate,
Yeah.
they're gonna have a job
Mm.
in the hospital. But nowadays, young generation, they follow the order of family, but some they have their own life. After they graduate, they choose their choice.
Yeah.
Yeah.
Yeah. It's good, those things will change. Okay. It will change, and that's the thing, like, right, we've seen a lot of people change their career paths later as well. Like, we have this program at Columbia where people have bachelor's degree in something else, history, biology, political science, then they come back to nursing. We call it the second degree programs. Many, we have hundreds of students every year who have degrees in something else. Now they want to be nurse. So it works the opposite way as well. Yeah.
Heard that in Colombia,
Yeah.
there is that program.
It's the biggest program.
Yeah, can you explain in the detail how you recruit and how they how program look like?
So it's not only big at Columbia, it's big in many universities, many. So every university has a different name. Some call accelerated program, others call direct entry program, others call second degree program. So basically, nursing is so well known now as a reputable career choice that guaranteed with a job that we just do go into the student fairs and the university campuses. That's how we typically recruit. But we know that in the US, it's really hard to find a job. Let's say you have a bachelor degree in English, bachelor degree in history, in sociology. These are degrees that's really, really hard to find a job. Then also a lot of students who want to become physicians, go to medical school, they are in biology. And then when during those years in biology, they realize that, oh, I don't want to go to medical school. I want to go to nursing school. So those are so typically we recruit on a university campuses and also in those student career fairs. But we never have issue recruiting for that program, which is very interesting, right? Like, it's and I used to teach in that program and I really liked it because everybody has a different backgrounds already. So we had students who had a political science degree. So it's nice to have nurses with a political science degree, you know? So yeah, so we recruit on campuses, online in career fairs. Yeah. Yeah. What is the program? So program is about 18 months, about 2 years, 1.5 year, 2 years. So it before, so they have bachelors in English, for example. They would come to our school for 2 years or three, it varies, a student. They would first get bachelors in nursing and then get a master's in nursing. But now we remove the bachelor's part, so they come and directly get a master's degree in nursing. So it's a very strong program, but it's very intense. So students are in school all year. There's no summer break, there's no winter break. So that's one of the challenges that we get sometimes complaints from the students that it's a very intense program. So within 2 years, 2.5, or depends, you get you get a master's degree. Some students choose to become a nurse practitioners. Some students choose, so in that program, when they get general master's education, then they can decide which program they want to be a nurse practitioner, they want to be a nurse midwife, or they want to be CRNA, nurse anesthetist. And then they go into those directions. For example, our CRNA program is a DNP, it's a doctor of nursing practice, which adds, I think, another year on it. So, so yeah, it's a pretty intense program. Clinicals are very heavy, because imagine getting both bachelor's and master's of nursing in like 3 years. So, yeah, something like that. Yeah. But students always complain that it's a lot. That is true. That I can say. But, but they also know that they can have a good jobs after those 3 years, because the nurse practitioner job market is very good. Yeah. Okay. I don't see any other questions on the chat. I want to make sure I'm not missing it. Okay. If we don't have, well, thank you so much for joining us on Zoom. I appreciate it. And thank you for being here today. Thank you for giving me opportunity to speak with you all a little bit. Have a wonderful rest of your day. Bye, everyone.